I wanted to talk about the book I'm reading, The Heart Healers by James S. Forrester, who is a medical doctor. And I'm currently reading the third chapter, which is called A River of Blood. Now, I'm not sure if you've been looking at my other videos, but my past video, I was talking about how in the last chapter, how a couple of guys, during World War II, opening they were finally starting to open the hearts because there wasn't really a thing for cardiac surgery yet. Back then, it was just opening a chest, and it was sort of restricted, and you're not allowed to go there because if there was any wounds to the heart, like any actual cuts that got to the heart, it was sort of like a no-no zone. You're not allowed to do there because you'll probably make the patient die. And this was during World War II, and so after World War II, there was many medical breakthroughs on this because they were saving people's lives who back then, not everyone's going to have a cut in their heart or get stabbed, but that's much better than just letting them slowly die. So because of this, there was not really, because it was sort of like amateur, there's no really one person to say, oh, he was the first one to successfully do cardiac surgery. So in this chapter, it sort of does, they sort of name the father of cardiac surgery. So the beginning of the chapter sort of talks about how, just after World War II, new illnesses were not the same ones as old ones. So, the new diseases were heart disease and cancer. Obviously, we don't talk about cancer in this one because it's a heart book. Talking about heart disease. And so, basically, that they were saying that all of the young thoracic surgeons who just came back from World War II, who just rejected the myths and beliefs of their surgical elders, as they were saying that, okay, no, we are going to jump into the heart if there is a cut or a wound. But then they would be the ones to confront heart disease. So yeah, and the author sort of goes back into his memory, and he kind of talks about how his father, who was a physician, and on his street there was many doctors in his street, which they kind of nicknamed it Pill Hill. And so sometimes his father would invite them in, and the boy himself, he would hide himself in the corner or under the bed just to listen to their conversations. And he was always dreaming that one day he also wanted to be like them, who would be beneficial and very knowledgeable and very humble in this white coat. And it's kind of funny because he became a doctor anyway. But anyway, he was saying that as he was eavesdropping, he couldn't imagine that the cardiologist can only had a small toolkit that was limited to a blood pressure cuff, an otoscope, a stethoscope, and a ECG, and a chest x-ray. And even worse, his medicine bag had little just aspirin, digitalis, nitroglycerin, and a few topical antimicrobials, and some derivatives from roots. And sort of the thing here was that he knew what the drug sort of did, but he didn't really know how it worked, if that kind of makes sense. He kind of knew what they would do to the person, but he had no clue how it would fix someone. So, kind of looking at this, the post-war cardiologist, basically, as he was saying, it was the quote-unquote, the art of medicine consists of amusing the patient while nature cures the disease. Because there wasn't really cardiology if you couldn't open the heart. If you were just to be a cardiologist and not even touch the heart, it was what exactly that quote is saying is that you're literally just amusing the patient as nature itself just takes care of the disease. You're literally doing nothing. Anyway, soon later in the chapter, it starts talking about this guy named Dwight Harkin, which was in the last chapter. And it was he was the one who, he was in World War II he was a surgeon. And many soldiers came back with many wounds to the chest, specifically to the heart. And so he did sort of this medical breakthrough, and I'm going to get the little heart model, that if there was a cut, he would slowly put his finger over it and slowly suture it as he would put his hand away, and then the heart would be fine. and no more leaking of blood. So he saved several lives that way. But then there also he was trying to get to the throne of father of cardiac surgery, but there was someone else who had sort of shared his vision, who was specifically on repairing the mitral valve. So I'm not sure if you know what the mitral valve is. I'm going to open up the heart here. Mitral valve, which is the one right here, is in between the left atrium and the left ventricle. And it's very important because, well, obviously, left ventricle, it pumps to the rest of the body. And so the mitral valve, in this case, we're talking about mitral stenosis, is when, as you know from valves, when they open and close, the problem with mitral stenosis is that when the valve is supposed to open, it doesn't open wide enough, so it doesn't let as much blood go through to the left ventricle as needed. So it sort of causes a problem, and eventually there's like swelling behind, because since there's not a lot of blood let through, there's still blood that is left behind in the other valve, in the other chamber of the heart. And so eventually what this does is that blood keeps swelling and swelling and swelling until obviously the chamber that holds all that blood can't take it anymore, and all of a sudden it bursts. And since the left atrium comes just after the blood gets refreshened and reoxygenized by the lungs, the blood kind of goes there, and essentially the person drowns in their own blood. It's a very, very horrific scene. So so Charles Bailey, who was the other surgeon who was also specifically trying to get the mitral valve, was the polar opposite to Harkin. Instead of being raised in rich Boston, he was raised in poor Philadelphia. So, and this was sort of near the Depression era of poverty, and his father was like a banker. And, well, obviously being destroyed by the Depression, he sort of lost a lot of money, obviously. But then he eventually died from mitral stenosis at age 42. So, as young Bailey was maybe a teenager, his father died of mitral stenosis, and eventually he would grow up and he would try to take revenge, and he would try to fix the disease that killed his father, so to speak. Then all of a sudden the book shifts to this one housewife whose name is Constance Warner. And so ever since she was a child, she'd been very healthy until one day, obviously, she would get a fever. And just like any other patient, they would all of a sudden fall into something that would seem sort of normal. Maybe you start getting a little cough, okay, that's sort of normal, until all of a sudden it starts lowering, it starts becoming more and more dramatic, and she eventually got a severe sore throat, and then she would start developing joint pain, and then she would get ring-shaped eruptions on her arms and legs. And so eventually when they took her to the doctor, they ran her through an ECG, which was abnormal. And at first they said it was rheumatic fever, which was which is caused by heart valve damage before the discovery of penicillin. And she was having a lot of trouble because after she gave birth to her baby, she was becoming more and more weak, and she eventually was unable to take care of her child, and she had shortness of breath. And so even after her doctors specifically told her she had a condition called mitral valve stenosis, which was no treatment, there was 2 surgeons, one in Boston, which was Harkin, and one in Philadelphia, which was Bailey, who were willing to tackle with their problem, but they did tell her that they had little to no success, as death came quickly with them only in the operating room. So all they did was speed up the process of death for these people. But eventually she ignored them and eventually went to Philadelphia. So we go back to Dr. Bailey, who's the one in Philadelphia. And going back to the topic, how he really wants to sort of kill the disease that killed his father. And so him and Harkin sort of have this talks about how they both want this ultimate final prize. They want to conquer coronary artery disease, and it's kind of like a race. Even though they're from far away from each other, they still are like almost like they're right next to each other, racing to see who can like fix this problem first. And so what Bailey first suggested was that when dealing with the heart, he would try putting his finger through the valve. Like once he opened it up, he'd put his finger through the valve, and like I can't really do it because the heart's too small, and well, I don't want to break my thing, but he would put his finger through, and he would sort of like ruggishly move it around, so then like it would sort of straighten the valves. And well, if you think about this strategically, if given luck, he could eventually like move the leaflets, which are like the little things here of the valve. Like this is a little leaflet. He can move the leaflets in order to he would be able to move the leaflets in order to make more space, and it's not all completely closed, and so the patient's blood could actually go through. So first she started with this 37-year-old patient. His name was Walter Stockton, who had 16 years of history of shortness of breath, and was diagnosed with mitral stenosis. So obviously Dr. Bailey would begin the procedure, but the problem is as he would put his finger through, while putting his finger through, he needed to put sutures around so then the valve wouldn't break off. But the problem is, after he put his finger through, the sutures sort of like acted as tiny holes. To try to explain this, if you had a piece of paper and you were to poke holes in like a sort of a circle, it would be easier to like rip out a circle if you had that shape. And so that's kind of what the sutures did. They became sort of like tiny holes, like a sort of pattern for the muscle and the valve to slowly like rip off. And because of that, blood went all over the place. And as he was describing, it was a massive uncontrollable hemorrhage result and immediate fatality. And so after a few hundred seconds, this patient died, and he had failed his patient. So instead of as he also failed the memory of his father, he gained nothing more but a new nightmare for him to live by. So obviously, given this failure, he needed some time. So 6 months later, he'd go to another patient who was 29 years old. Her name was Wilma Stevens, who was a mother of two, who is also brought up by the disease. And eventually he would try doing it again, except this time he would try to fit a tubular metal device over the tip of his finger because he thought that his finger was too big and he ripped it. So he tried doing that again, but once again, the problem happened again, and he would eventually, the valve just came out, and he failed again, and he would get the same misery. He would eventually be called Butcher Bailey, which he really did not like the name. And eventually he had to talk this out with other patients and other doctors because they were sort of trying to halt him. And he would have to go to this other patient, which then again who also survived the procedure before, but then he would kill him again. He would do this one more time, and eventually there would be 4 people dead. and he had one more plan of action. He had one more day to do it. He would have one more. There was 2 hospitals at the end of a city, and he would go to one hospital, and he would do his procedure there. And saying that he would fail, of course, he would try to drive all the way to the other side of the city to do that procedure before word came out. Because if he failed again, he would be kicked out and he would not be allowed to do it again. So he was hoping that his car was faster than telephone, so to speak. So eventually we go back to Constance Warner, who awaited him. And this time, the problem with hers is that the leaflets in her heart sort of were sticking together. And so when he did that, he did the hole again, but this time he was able to take his scalpel and do a small incision to release the 2 apart. And eventually, Constance would be alive after her sleep of being operated on, and and Warner and Dr. Bailey would soon sort of tackle his fear, and almost after that he would never touch surgery again because he sort of tackled his fear from his childhood. But yeah, and it sort of leaves a small afternote about what happened to Dwight Harkin, who was the race's apparent loser, and I'm assuming that will be for the next chapter. But yes.
Okay, so what is the main part you learn here?
I think the main part is that, I don't really like the way Dr. Bailey sort of, try to muscle his way through it, like constantly trying the same procedure again. I mean, that works. It's a good thing to do, but I don't necessarily approve of it, sort of just like thinking about it, because you have like animals to try this out on, and he's been constantly trying it out with humans. So, because in the book he was saying that he was working with animals trying to perfect this procedure, but then he killed, those 5 people didn't have to die.
Okay, so actually, but can you reproduce in an animal exactly the same issues and you have with this patient?
No, but like, you can sort of do the same thing, try to figure out how you're going to open up the heart. You can like maybe stick the valves together, or like you can find a pet or a animal with sort of the same.
But in US I believe that a lot of these animals are protected. We cannot do that
now
anymore. So how would you fix any new problem in that case?
In a new problem like that, you would try perhaps I would like go to a cow, because obviously, did you know a cow, more than half of the parts is like wasted?
Yeah, but this is when it's alive. That's what they do then. Yeah. So, but yeah, actually, that's not okay. So, you feel bad that so many people had to die on this, yeah, because you know how to fix a problem. So you try with them, and it was a try and error.
Right.
Situation. Yeah.
The way that a lot of people see it, because I learned this in history, sort of thinking about, if there's one death, it's tragic, but if there's a million, it's only seen as a statistic.
Okay, yeah.
So, yeah.
So, okay. Is that common? Do you know if this problem that he's describing, is that something common that a lot of people got today?
Mitral stenosis?
Yeah.
I'm not sure, but
okay.
I'm sure there's probably a solution today.
But that's probably the same solution.
It probably is, yeah. But it's probably better.
So before this, people never go inside and fix inside the heart and really fix anything.
Not really. Obviously during war, there's a lot of opportunities to do that, because the rules are sort of like being able to like bounce around and move to the side, right? But
okay.
Yeah.
Okay, thank you then.